More GP clinics are getting ready to conduct swab tests for suspected COVID-19 patients. One medical group says it's expecting about 200 of its clinics to come on board progressively. That's on top of the 140 clinics already announced by the Health Ministry. CNA understands foreign workers not in the domestic sector will also be given a treatment subsidy at public health preparedness clinics.
This GP clinic is gearing up to do swab tests on suspected COVID-19 patients. Previously, GPs had to refer them to a government hospital.
The hospitals would then actually perform the swab test as accordingly, and then will normally send you home from there, and then monitor over the next 24 hours to 48 hours, and then that's when you get results. The difference right now is that instead of going to a government hospital and flooding the A&E, right, the primary care space is taking over this. We are able to actually identify patients who require the swab and then perform the swab on the spot. If a patient has only to go to a GP and then back home, the amount of time this patient spends in the community is much reduced.
Doctors must put on additional protective gear and must meet strict criteria before they do the swab.
We are not allowed to actually execute these swabs for patients who do not fit the relevant clinical criteria. The first criteria will be patients who are clinically detected to have pneumonia or possible clinical evidence of chest infection. Number 2 will be patients with a prolonged cough, cold, rhino symptoms as well as fever of 4 days and beyond. And lastly will be any patients with any cough, cold, rhino symptoms and has been overseas for the past 14 days.
So far, the clinic has done over 5 swabs and is one of those under the MHC Asia Medical Group, taking part in the Swab and Send Home initiative. And MHC says bringing in the private sector will help fight the virus better.
It is actually important for panel clinics or individual private GPs to onboard this program to actually help alleviate the burden that the national healthcare is actually experiencing. So this will actually help get the number of people tested quicker, and it's actually more convenient for the patients as well.
So far, MHC says about half of its 400 PHPC clinics have expressed interest to take part. Meanwhile, Healthway Medical Group, which operates about 40 clinics, says it's also rolled out swab tests at some outlets. Meantime, CNA understands that foreign workers with respiratory symptoms, except those in the domestic sector, will now get a treatment subsidy that will also cover such swab tests at clinics. The move is set to encourage work permit holders to seek timely medical treatment.